course, reports show that there is a surge in mental health cases in the Ashanti region. Health authorities there say that the region has seen a rise in the new mental health cases from 2,555 in 2016 to 2,994 and over 3,000 in the second quarter of this year. Now, they also say marital problems, drug abuse and poverty are the main causes of the soaring numbers over a 3-year period. Now, my colleague Ohiming Teria has been looking into the issue and brings a report of a 32-year-old mentally ill woman.
Were recorded in the first half of this year, up from 2,555 in 2016 and 2,999 in 2017. Officials say unfulfilled relationship promises are driving especially young women into mental disorders. Regional Mental Health Coordinator Faustina Nuako says sexual relationships among the youth also need special attention to halt the development. Marital failure and drug abuse are other leading causes.
It's all about stress. There are a lot of stress in the system. You can see that we have a lot of disappointment. Most of the youth are now engaging in courtships. When you get to the tertiary institution, they are in courtship that they don't even understand what actually they are doing. Most of the women too, they use their parents' money or the little that they have to sponsor the men with the aim that they are going to get married in future. But they disappoint them, and when they are being disappointed, they think about it and they have mental health, mental conditions. Then we have marital issues. People who get into marriage and the other partner cheat on the other one, and that one too also lead to mental condition. Then we have drug abuse.
Amma was jilted by her boyfriend after a 3-year relationship. She is currently undergoing treatment at a service center. For her, depression means the end of her world.
I used to cry myself to sleep. I became very bitter, and I still am. You know, anytime that I see or hear of my colleagues who are also getting married, I just cry and I ask myself, what have I done so wrong that I'm always encountering, like, any relationship that I enter, it doesn't last. I'm very bitter, and I must say that I have given up on love, and I keep to myself most of the time. There are times I feel like ending my life because of this situation, but you know, anytime I'm alone and I begin to ponder over how I've helped this particular guy and other guys which I've also dated, it hurts me a lot. It hurts me, I must say. It's really sad, and my heart breaks.
The alarming trend comes despite improved mental health care, as many health facilities have mental health units to treat patients. 63 of such facilities are spread across the Ashanti region. Mrs. Nuako wants intensified public education, especially to the youth, on life-threatening decisions they make.
The health education, educating the youth about what this courtship relationship, that they should make sure that they have what they are employed, they are engaged in something that when they are in courtship, it will not affect them much. We have to educate them on the drug abuse. That these drugs, it will not lead you to anywhere. It will make you get mental problem. The alcohol abuse, all these things. When we educate the youth, I think when the education increases, it will bring the mental health cases down.
From Kumasi, for JoyNews, Ohiming Teria reporting.
Right, a serious situation. We need to learn a bit more about it. So why don't we speak to Ohiming Teria, who joins us live from the Ashanti region. Ohiming, tell us, what are the authorities doing about these rather alarming figures?
Thank you, Kojo. First is to increase the experts present in the region. First, there were issues of mental health units very scarce in the Ashanti region. But if you look at the number of health facilities providing psychiatry services to the people, then they say it's one of the boosters in dealing with this issue. They have, across the entire Ashanti region, 63 of such facilities. They have 25 hospitals providing such services, and then 20 2 health centers. And then with the CHAC facilities, they also have 11 in the region, all supporting this cause. And they are also providing education, though they say education is not enough. They wish they have enough funds to reach out to, especially those in the basic schools, in order to tackle this problem. Initially, I thought it was an issue basically with those in the tertiary level, but the experts tells me even those in junior high schools, especially the girls, are also involved with this courtship issue where they have intimate relationship with their male counterparts. So these are some of the issues, what they have been doing to improve the situation in the region.
Now, Ohiming, it sounds like something that could happen to pretty much anyone. Have the authorities set themselves any targets for the coming years as to how much they would like to reduce these numbers by?
For targets, yes, they do have targets to tackle the menace. And they tell me they have introduced what they call DIMS. The DIMS are improved way of collecting data using modern ways to collect data on mental health. And beyond this, almost every facility in the region also have this system where they can use to collect information on a daily basis. So as and when new patients visit the facility, the data is entered and it hits the national level or at the regional base where those in charge can monitor and also assess these data. And beyond this, they have also introduced people who have already gone through the situation to be part of the education drive. So, for instance, if they are talking about alcohol abuse, they get persons who have fallen victim to talk about this alcohol abuse in the team. And they also have people who have equally, suffered depression as a result of broken down maybe marriage or relationship. So they have set targets for themselves, but the difficulty is how they'll be able to meet those targets as far as funds that they will need to push these targets is concerned. And that is one of the major concerns for health authorities in the region. Once they have enough and adequate funds, they told me they will be able to meet the target.
That's very enlightening, Ohiming. Thank you very much for that. And of course, Ohiming Teria is our correspondent from Love FM. We'll continue to keep an eye on that story.